What I notice a lot of times, especially when I initially go into a practice, is that dentists feel like they have to micromanage. They've got the stress of dentistry in itself, and then they feel like they're not sure if that patient has gone through with the treatment plan, so they're kind of constantly checking on their staff. With the PracTrac system and implementing all these new systems and procedures, they can rest assured that patients are always having a follow-up plan. So it's less stress for them, less micromanaging. They can actually focus on dentistry, which is what they should be doing. They can go away on holidays, family holidays, just knowing that their practice is still going to be working, as I say, like on autopilot, without them having to be there. Each practice that I've been in, I've noticed the same common pattern, which is patients getting lost in the system. I've actually invented a way that the patient is always tracked from when the very first time they come in, and they're kept active in the system. Well, because you're constantly in contact with the patients feel valued. They feel like they matter, and that the practices actually care about them. You know, if you say to somebody, oh, you need to come back for this treatment, and you never follow up again, the patient will probably either forget they need the treatment done, or they just think, well, you know what, they don't really care about my teeth because no one's been in contact with me. I like to focus my full attention on each client, give them the individual attention that they need. Every time the practice rings up, they're only going to get me. I'm not there on Zoom. I'm not over East. I'm flesh and blood, and I'm the person that they deal with from start to finish. The poor dentists, they close their practice for a day, then they're sending all their staff for a day or two of these training sessions. It's all very well to sit there and listen to what they've got to say, and this is what you need to do, and here's the tools. But then nobody follows up with the staff, because if no one's watching them, let's face it, why were they're going to change? They're just going to go back to what they were doing before. So that's why the monitoring process is something that I'm pretty sure I'm the only person that does, because I've got the time to do it, and that's why I work with a handful of clients, because that's essential. Eventually it gets so ingrained in the staff of doing things, and the practice runs like clockwork, and it's essentially runs on autopilot. A lot of them tend to worry about that I'm going to step on people's toes, you know, when I come into the practice, because the staff are going to be, oh, who's this chick coming in? But when they get to know me, they get to trust me, and think that she's not a bad person after all. And they know then that I'm generally there for the growth and success of the practice. The dentist just really wants to focus on dentistry. That's where I come in, and I'm happy to take that on board so that they can just focus on dentistry. Step one would be what I call the discovery session. So we just sit down, have a chat, make sure we're a good fit, make sure we've got realistic goals, expectations from what I can bring to their practice. Step two would be a comprehensive audit report, which is a clear, definitive roadmap of what is actually happening in their practice. So this goes to show all the leaks that are happening and how they can be fixed. With the audit report, once that's done, we go to step three, the implementation. So if you've got a staff member that has the time and the skills and the experience that can implement that to your staff, go ahead by all means. Or if you want me to do that, I will implement the systems and procedures, train the staff, a lot of one-on-one training, and then I also monitor to make staff accountable to making sure that they're following through with the procedures and the systems. I would say on average 6 to 12 months would be ideal. As I said, depending on also too the size of the practice, how quick staff are picking up things, but usually 6 to 12 months, because it takes that long to actually get these systems and procedures ingrained. I get to know their staff as well, they get to know me, we build a good relationship, we get to trust each other. I'm not working against them, I'm working with them, and it's going to make their job easier at the end of the day, and it's got to work a lot better effectively, and it's going to work like clockwork and essentially put the practice on autopilot really.